Hello, my name is Ellie Cox. I'm here to open up about a passion of mine, saving children from a childhood that I went through. I grew up as a child of divorce, and a few years later, my mother became an alcoholic. During this time, I was diagnosed with depression, anxiety, and ADHD. But how does a happy child suddenly have so many issues to face? This isn't just my experience, but many kids across the US. Most importantly, there is something we can do about it. In Washington state, 48% of children cannot get access to mental health care when they need it. My vision is to see that number fall. When we break that number down, we see 36% of parents reported their child showing symptoms of depression, anxiety, and eating disorder, and more. In schools, they did a survey and found that only 27% had no depression symptoms at all. Furthermore, there's been no significant change to this percentage since 1999. Thinking of my story that I told at the beginning of this presentation, I had experienced something called ACEs. ACEs is an acronym for Altering Childhood Experiences. ACEs include a variety of altering experiences, like psychological, physical, and sexual abuse as a child, as well as substance abuse and violence in the home. These are crucial to recognize, treat, and prevent, as they can lead to many issues down the road. Because not only does it increase a child's risk of having depression, anxiety, and PTSD, but many physical and substance abuse issues as well. A study was done in China, which used the ACE IQ questionnaire. This questionnaire was developed by the World Health Organization. With this questionnaire, they analyzed the correlation between ACEs and overall health issues adults experienced in the future. They found that the more ACEs a child experiences, they are at higher risk of being an alcoholic or having substance abuse issues, getting chronic diseases like diabetes or heart disease, and as previously mentioned, having lifelong depression and experiencing post-traumatic stress disorder, also known as PTSD. In addition, youth are more likely to use drugs in a house where drug use is prevalent, or if a child has pre-existing mental health issues. I know I fell victim to this. I started drinking, partying, and smoking in high school when my mother became an alcoholic, and then later in life, as I stated, I was diagnosed with ADHD. In Washington, they found that smoking cigarettes was significantly higher in 10th graders with a disability or those in low-income households. They also found that about 45 kids start smoking every day in Washington. In terms of marijuana use, each grade was significantly higher since the last assessment, which was taken in 2007, with a 45% increase in the use of marijuana in 12th graders. This rise in numbers is scary for the future of these kids. Researchers in California became interested in the long-term effects of smoking marijuana starting at a young age. They found that adolescents who smoke marijuana are more likely to begin smoking and vaping, participate in hazardous drinking, delinquent behavior, and physical fights. I cannot forget to stress the negative health effects that drug use has on the body. Higher higher risks of cancer, stroke, heart disease, and EVALI, also known as e-cigarette or vaping product use associated lung injury. This new kind of respiratory failure comes from vaping, with over 25,000 hospitalized patients and 60 fatal outcomes. Now my proposal to see those numbers go down. I want to utilize the Spark Grant to hold a 2-day mental health event inspired by the Seattle King County Clinic, which provides all kinds of medical services free of charge, and I'm hopeful that an altered version can be as impactful to Tacoma as the Seattle Clinic has become to Seattle. This event will be volunteer-based, made up of mental health professionals. These professionals will be able to treat, diagnose, and help families sign up for services where they can get access to prolonged treatment. They will hand out pamphlets and send email copies of treatment plans they have discussed. I want to give people access to services that they may not be looking for, but need, like housing services, rehabilitation centers, nonprofit organizations, and more, making treatment as accessible and easy as we can. I want to provide online sessions to teens and families to sign up for as well. This will be ideal for families that cannot make it to the event space itself or volunteers that have an at-home office. This will enable volunteers outside of Tacoma to participate in the event in an online setting, allowing further outreach to teens and children all over the Tacoma area. We would use the clinical service called Doxy Telehealth, as they have an amazing confidentiality service. We will measure success based on how many teens or youth come to the event and get treated, as well as checking back up on them and seeing how many followed through with the prolonged treatment plan. I imagine the space looking something like this. We will use a portion of the Spark grant to rent out an office space or community center in which we can build cubicles in. This will give a private area for the families or teen to have a discussion with the mental health provider. We will also use the Spark grant to purchase free food and drink for the families as they wait. Now, I also understand that children may not look up this on Google, especially teens. I know I didn't. This is why outreach is the best thing that we can do. Weeks before the event, flyers, online ads, and emails will be crucial for the event's success. I will inform behavioral health services, schools, nonprofits, offices, and anyone in the Tacoma area that may have a connection to a teen in need. This event will hopefully become yearly, like the Seattle King County Clinic. I imagine youth getting proper treatment for mental health issues, drug use issues, and having plans to keep improving. Parents being told about ACEs and its risks if changes are not implemented into the household. Us watching the numbers slowly going down and at-risk youth getting the access to care they deserve, ultimately bettering their future. On the other hand, though, we could just sit aside and keep watching the numbers going up, drug use becoming more prevalent, depression going untreated, and ACEs causing our future adults to plummet into the ground. Yes, they can always get treatment in the future once they climb the ladder themselves, but prevention is always the better option, stopping the cycle as soon as we can. 2 days can make a life of a difference, not just for us, but for our future. The most important thing I want you all to remember is our body and brain are interconnected in ways we understand and those that we do not. Please do not let anyone, especially a child, become just a statistic. You can also donate money if you have the means to nonprofits in the area. I would recommend the Coffee Oasis, which helps teens experiencing homelessness find a home, as well as helps treat drug use issues and mental health issues in them. Thank you.